My question is to the Minister for Energy and Climate Change. Labor promised Australians that their power bills would fall by $275 in 2025. Is the minister aware that it is now 2025 and that electricity bills are up by nearly 40%? Why did the minister mislead Australians?
The member for Spence is warned. The Minister for Climate Change and Energy has the call.
Thank you, Mr Speaker. Yes, I am aware it's 2025. I'm not entirely sure the National Party is. Mr Speaker, I'm also aware that there are considerable pressures in our energy system, as there are around the world. I'm also aware of the AEMO quarterly energy dynamics report released today, which is a welcome progress report, which shows wholesale prices down 27% year-on-year and 38% quarter-on-quarter. I see this as good progress, with much more to do. And there is no coincidence. It is no coincidence that the quarterly report, which showed a 38% reduction in wholesale prices, also shows the highest renewable penetration for that quarter in Australian history, Mr Speaker. This is the sign of progress. Now, we have never said that there isn't a lot more to do. We haven't said that there aren't pressures in the system, which is why we've introduced 3 rounds of energy bill relief, which were opposed by those opposite. That's the difference between the two parties in this House, the government and the opposition, is that we recognise the need to ensure that we have more of the most reliable and cheapest form of energy, which is renewables, and those opposite are opposed to it.
Call to the member for Newcastle.
Thank you, Speaker. My question is to the Minister representing the Minister for Women. How has the Albanese Labor government's investments into healthcare created more choice and increased affordability for women?
Call to the Minister for Infrastructure, Transport, Regional Development, Local Government and the Minister representing the Minister for Women.
Thank you very much, Mr Speaker, and can I thank the member for Newcastle for the question. The member for Newcastle is one of the people in this place who has done a huge amount, not just for women's health but across the whole spectrum of issues that affect women. You couldn't have a greater champion than the member for Newcastle. Women's health care is, of course, not just a women's issue. It is crucial to our families, to our communities and our economy that women are able to exercise choice and control over their health care. As a government, we do understand this, and it's why, when we came to government in 2022, we made it one of our top priorities. This government has been working to reverse years of neglect to women's health, with our $729 million package to deliver more choice, lower costs and better health care for women. Women have asked government to take their health care seriously, and we have listened. Our landmark women's health package could save women and their families thousands of dollars across their lifetimes. And I'm very pleased to report that in just 48 hours, many of these changes will come into effect. From the 1st of November, women will have better access to affordable contraceptive options thanks to this government's women's health package. We're providing Australian women more choice, lower costs and better support for long-term contraceptives, with larger Medicare payments and more bulk billing for IUDs and birth control implants. Medical rebates for insertion of IUDs and birth control implants will increase by up to 150%, with around 300,000 women each year expected to save up to $400 in out-of-pocket costs. And we are funding free training for healthcare practitioners in the insertion and removal of IUDs to boost the number of qualified practitioners and improve access to services. A 40% bulk billing incentive will incentivise health professionals to provide long-acting contraceptive services and support more women to choose the contraceptive options that work best for them. We're also providing new contraceptive options, NuvaRing, which is through the PBS, providing women more choices at a much more affordable cost. Before the listing of this contraceptive option on the PBS, women might have paid more than $270 a year. Now they will only have to pay $31.60 per script or $7.70 if they're concessional. These changes should not be underestimated. For many women, they are life-changing. They, of course, come on top of the first PBS listings of new oral contraceptives in more than 30 years. The AMA has said our package is a major investment in women's health. The College of GPs has said better funding for women's health is an investment that will pay off and improve health care. On this side of the chamber, we are investing in the health of women.